Hi everybody, it's Lisa Marie here. Hi my sweet lifers. We're doing another Martini Talks and we're hanging out with my good friend Dr. Patel at Renew Skin and Laser. And guys, I gotta tell you, I've had a lot of work done and she's done a lot of the work. And if people see me and they go, oh my God, you look so great. I'm like, yeah, I've had a lot of work done. And I'm the first one to admit it. I had a friend today actually on Instagram post that she'd gotten her hair white. She had furrowed brows. She was damn proud of it. She wasn't interested in getting any work done. She was going to age gracefully. And I wrote her back and said, I'm going to age gracefully too. With my hair dyed and my boobs fixed and my face lasered and all the things will be done to me so that I look as young as possible for as long as possible. So thank you for being here.
Thank you for having me.
And thank you for fixing me.
Anytime.
Yeah. So talk to me about what you got going on. I know that one of the things I wanted to make sure I mentioned to the viewers, one of the things that really stands out to me and is important to me, y'all know that Daddy was a doctor, and I am a big fan of having physicians do stuff. If it's going to happen to me, it needs to be done by someone who is knowledgeable and trained in all the things.
Well, it might interest you to know that in the state of Texas, anybody can inject you.
Wow.
It's not monitored.
Wow.
It's not. So a lot of the med spas that are coming up and springing up, a lot of it's patients that are going there and they're not reading about the background of the person putting needles in their face.
Wow. I had no idea.
Mm-hmm.
That's crazy.
Mm-hmm. Only about 2 states are better regulated or very well regulated. California, obviously.
Right. Where it all began.
Where it all began.
Where it all began.
Exactly.
Oh my word. I had no idea. I thought for sure there had to be some sort of at least some sort of a esthetician training process or some sort of something. You can just open up a spa and do it.
Start injecting.
Wow. Mm-hmm. Well, there's so many things that can go wrong. I mean, good Lord. Even if you just watch the cute commercials. Before I was getting stuff from y'all before I watched the commercials even came before afterwards.
Yes.
If you look at the listings, Botox can cause all kinds of stuff. If you hit the wrong nerve, hit the wrong vein.
Yep.
That's dangerous.
Well, Botox, yes, but Botox will wear off. Fillers can make you blind if you put it in the wrong artery. And you can get, vision loss, permanent vision loss sometimes. Oh, man. So you really should be doing procedures with someone that's, knows where all of the landmarks are.
Wow. Yuck.
Yeah.
That's so scary.
Mm-hmm.
That's so scary. Well, talk to me. Y'all do a lot, right? And I've had a lot done.
Yeah.
And I've had a lot done. I've written about it in my columns,
mm-hmm.
and people have seen that and then gone to you guys, and mm-hmm. I've written about y'all in my columns as well. So, but yeah, tell me kind of, what's the sort of the gamut of what you've got?
We pretty much focus everything on aesthetics and anti-aging. So that is all we do. We don't do any traditional medicine. We don't operate. We only focus on anti-aging and aesthetics. And I have a very love-hate relationship with the Kardashian show because
I never watch them.
Well, they kind of put the fillers and the anti-aging and the aesthetics into the mainstream.
Okay.
However, then the flip side of that coin is people want to come and they want to look like that. And guys, that works for Hollywood. It doesn't work for Sugarland.
It doesn't work in real life.
It doesn't work in real life.
Yeah.
It really doesn't. Yeah. And the other thing people don't realize is the long-term complications of these serial procedures of overfilling your face, because one day we're all going to turn 80.
Yeah.
And when all of those things deflate, we're going to have overstretched out skin.
It's kind of like my philosophy about the tattoos. And,
yes.
And so Dr. Patel's partner, Nina Desai, is also a dear friend of mine. And when y'all started doing the mm-hmm. tattoo removals, I thought, praise the Lord. Because so many of our clients for the photography business, they get covered in tattoos. And then when they come in to be photographed, they want me to remove them in Photoshop. And I'm like, why do you even have them if you don't even want them in your pictures?
Yep.
And when she started showing me, that great laser mm-hmm. that you've got that gets mm-hmm. rid of them,
mm-hmm.
I thought, wow, that's great, because I kept thinking in my mind, you know what, that might look great on like a 20-year-old's,
mm-hmm.
talk.
Yes.
But when they turn 100,
yep,
oof,
and that skin gets...
look, yucky
yep.
poo. Like a deflated little doodah.
Yes.
Deflated little whatever that was. Wow. So you've got lasers. That's a big deal.
When I say lasers, we have 10 lasers. I always tell my patients It's on how you're going to age in the next 10 years. When we look at our patients, we're not looking at 6 months down the road. Yes, you may tell me, Dr. Patel, I hate this wrinkle on my forehead.
Right.
Make it go away. But to me, it's how do I get rid of that wrinkle? How do I make that face not, shine like a mirror 10 years down the road? And those people that have overdone the toxins and overdone the filler look, and you can see a reflection in their foreheads. And so those are all things you have to think about in the moment, is what are you setting your patient up for in the long term, and not just giving them what they want.
Like right now.
Right now. And, a lot of patients bring in celebrities. So to give just a celebrity example, I always tell my patients, it's like you're trying to decide, are you wanting to age like Joan Rivers, God rest her soul?
Yeah.
Or do you want to age like Meryl Streep?
Yeah.
And she looks amazing.
Yeah.
Amazing. And natural.
And Dolly Parton looks great too, guys.
Dolly Parton looks amazing.
Yeah, I mean, she does. She really does. For how old, and Cher, I don't even think Cher's had anything done ever. I think it's just jeans on Cher.
Oh no, she's had stuff done. But that's the beauty of lasers, is you can't tell.
You can't tell.
You can't tell because it's that natural, graceful anti-aging, right? And so it's not your instant gratification, but it is what keeps you looking like this 10 years after being with us in our practice.
Right. And that's the thing, because people will say, well, what have you had done? I'm like, well, it's really more of a question of what I haven't had done.
Yeah.
Because the Cabela hurt. I mean, guys, I'm not going to kid you. I had that little fat pouch, and I was in an interview on TV, and I went running over to Nina, and I said, fix it, make it go away. She goes, that's Cabela. And it, was a big old bullfrog.
You look like a bullfrog for about a good 3-4 days.
Hurt, but it's gone, right? Mm-hmm. It's gone. And then when I wanted to do the lips, that's the thing I love the Cabela, because it's not coming back.
Yeah.
Ever.
And now we have even better stuff.
But we did the lips, and the lips were like, Brian hated the lips. And he was like, what have you and Nina done? You look like, and that's not the way you're supposed to look.
Yeah.
And so it went away.
Yeah.
It went away. And then when it came time to do it again, or work on it, tweak it again, it was just a little bitty bit.
Yeah.
Just enough that the lipstick looked good, but not like, here I did it.
Yes.
Because there's a huge difference. And people, if they don't know who to go see, and they don't know how to do it right, you can really come out of there looking like a fish.
And you have to understand, we have a selection of about 7 to 8 different products that I could throw into your lips, and each one of those products will make your lips look differently. So it's also about knowing
which one
and which one your patients can pull off, in your face particularly, because what you can pull off, I can't pull off, right?
Yeah. And I remember Nina did some fillers one year. We kind of got rid of some lines over here. And then, of course, I've sat out. Y'all that watch me and know what's going on, I had the stent surgery done, so I've sat out for a good, this is the longest run I've been without Botox and stuff stuffed in my face.
We'll catch you up, don't worry.
Yeah, I'm excited. You have no idea how excited I am. I'm tempted to take myself off of those heart meds for like a week, even though I'm not supposed to, and then come in, and then you can do what you want to do. They let me come off of them for a little bit to do some oral surgery. And so I know it's safe enough if they'll let me do that. But yeah.
Well, until it is safe for you to do that. We also have an amazing laser. It's called the Opus. And if you guys go on our website, renewlaserandskin.com, you can see the before and afters. And, I actually had a patient come in who is completely resistant to Botox. It doesn't work at all. Her body has developed antibodies.
Wow.
To toxins. So no Botox, Dysport, Zeman, none of them work on her. And she came in and she said, Dr. Patel, I'm too young to look like this and to have this many deep lines. And so we did a couple sessions with the laser. Now, obviously, it's not going to replace the Botox, but you know what? It's still way better than having to live with it.
Yeah.
So yes, all of our patients have medical restrictions or downtime restrictions, but we really try to kind of customize.
That's what y'all done with me.
Need.
Yeah, because the last time I went in, we did a laser. And then, of course, y'all know you're watching the channel. I'm in the garden, doing the Sweet Life Garden all the time in the garden with Carl.
Which is why we have to cut her off half the time.
Yeah, and they have to cut me off because it's counterindicated to throw a laser on your face and then go out and put your noggin in the sunshine.
And that's how you burn.
Cool. So, okay. You have to decide what's more important. Right now it's cucumbers and salsas and all of those good things.
And burnt skin is not a priority right now.
No.
Yeah.
You're on.
So you were doing on Instagram this wonderful oil, and then I came in to get stuff, salicylic acid for James Edward, because we've gotten him so rotten. He's already using Abaji, and he's not even 20. So, but you know what? His skin looks amazing.
Can I tell you what you're doing for him though? Yes, you may be giving him the good stuff now, and in your mind you're thinking, he's not even 20. Why does this beautiful 20-year-old skin need the expensive stuff? But you're really saving him from putting in the pigmentation and the scarring. And that's, I mean, you guys will see, we have a whole acne month coming up. But I try to stress that the younger they are and the better you preserve. That's about preservation. Yeah. Otherwise, he's looking at having to spend thousands of dollars in, corrective treatments just to smooth out that skin.
And what's interesting is that a lot of the kids, because he just graduated, a lot of the kids, the parents just handed them a bar of soap. Mm-hmm. Here you go. Deal with the acne. That's what mine did to me.
Yeah.
And luckily I didn't have a lot of acne, but I had acne. Mm-hmm. But he has been able to avoid that. Mm-hmm. I mean, the Obagi salicylic acid, that's just amazing for teenagers, for sure. But this oil, you were doing this oil on Instagram, and I came in to get James's stuff, and you gave it to me, and I've been using it, and I'm going to actually do a little post. It smells wonderful. It's really neat.
The hibiscus oil in it.
So good. It's just good.
So she's actually talking about the Obagi Hydro Drops, and living in Houston, and personally having oily skin and acne-prone skin, I'm always looking for that right balance of moisture. Mm-hmm. Without clogging. And so when Obagi came out with their Hydro Drops, they're so much fun, guys. They're little gold beads, and it has vitamin B3, it has peptides, it has hibiscuses, which is what makes it smell so
smells
good.
Like a spa.
Yes, it does. And I have found it to be my saving grace in the summertime, because half the time, if I'm outside with the kids in the afternoon running around for a bike ride, I don't want to put on and layer things on, but I do still want to treat my skin well.
Right.
And so that's such a great summertime, lightweight, but still very moisturizing. Hyaluronic acid holds 100 times its weight in water. Yeah. So anything with hyaluronic acid, and then when you add other good things like vitamins and things, it makes it so much better.
Yeah, for sure. So you're doing threading. That's another thing that she's doing, and it looks scary to me. What is that? Describe to me what that is.
So she's talking about PDO threads. We have been a little bit hesitant to bring on threads because a lot of our patients have asked us to for the last 4 or 5 years. But we don't believe in bringing just anything on. We're very, very particular about what we touch you with and who we let touch you too.
Yeah.
And so people have been asking us about PDO threads. Well, recently Nova Threads redesigned the whole concept of PDO threads and made it much more effective. But more than that, it made it much more safe.
Okay.
So what PDO threads is, the same sutures that your father used to sew up those women, that my 2 C-sections that I've had, right? You put the sutures on the inside. What happens is your skin approximates, it builds that collagen, it grows and heals that new skin, and then eventually your body breaks those threads down.
Okay.
We just decided to take that power and harness it and put it into aesthetics. And so there's 3 different types of threads. Now the most common are what you guys are going to see on Instagram and YouTube are the barbed threads. And they literally act like a pulley system. You can put them in the jawline and it pulls everything back. You can put it here and it pulls everything back. You can put it here. Bella Hadid's famous fox eyes. That was threads.
Wow.
So barbed threads are amazing. And the reason, and I love them for actually someone with a round face like you. I'm sorry, but fillers for you are not, it's not good. You can't put fillers here to pull this back on you.
No,
I would just box you out.
Yeah.
And you're already full. So threads are a great way to lift and tighten without having to put volume back into your face. So that's the barbed threads. They also have twist threads, which act like little micro fillers, right?
Okay.
So a lot of times when people have the little 11s here, we'd hate to fill those because 99% of blindness is caused by putting fillers here.
Oh, no.
So we don't do that. But even underneath the eyes and things like that, it's a very natural and subtle way to build that little bit of volume without actually putting a syringe of filler. And then the smooth threads you can put, you know how a lot of people hollow out through here?
Yeah.
You can essentially put it in as a meshwork and it builds that volume and that collagen.
Wow.
But it's making your own body do it.
Right, which is a nice new
twist
to it. Yeah, instead of putting something in, it's actually you're just using your own body to do whatever. I think that the barbed threads for me
Yes.
would be
yes,
the one we
yes.
would do.
And maybe a little bit of twists in the top, just for prevention, not for anything else. And so I love the idea of threads. For my 20-year-olds, I'll tell you, Botox is amazing, but you know how people have the really thin foreheads here, and then they start to get the creases right above the brows.
Yeah.
Well, guys, I don't know if a lot of you know this, but you can't put Dysport, Botox, Zeman, you can't put toxins here because otherwise you'll drop.
Right.
And you'll have to lift your eyes to see your drive. So how do we get rid of those lines that are in those places that toxins are a bad idea for? And so when you start threads, and you build the threads up over time and you keep up with it, then I never have to touch that area with a toxin, ever.
Wow.
So our field is doing some amazing...
Yeah, and that's new. That's actually really, that's really new. Because 2019 was kind of the last time I went in and had like, because I try to go and get the O shot and the J, the Juliet done right around the anniversary. It's very important stuff. We can talk
Before
about
the
that.
anniversary.
Yeah, we'll talk about that in just a second because everybody's always wanting to talk about that. They're like, what are you doing? What is that? What is happening here? And I'm like, oh, it's no big deal. And they're like, eyeballs get big. And I'm like, Nina knows what she's doing. It's all good. It's all good. But before that, it really was. I think she was putting, is it Dysport? I think it was Dysport. Just in here and around here. And, you know, my shooting eye is my left eye. That's the distance eye and the eye that's been trying on monovision. So the right is for reading and for doing all the things I have to do up close. The left is always the shooting eye. And so I shoot automatically with that right eye shut. So there's always more wrinkles on the right than on the left. And so my whole thing has been to make sure that matches this one.
So then all we have to do now is go in and throw threads here, leave this side alone.
Yeah.
And so you're slowly and gradually and naturally building that, smoothing that out.
Yeah. So now you have got, let's talk about the O. Let's talk about it. Let's go ahead and
talk
just
about
go
it.
there because it's, you know, it is what it is. So back, I don't remember when it was that we did 9 or the first one. Maybe it was,
I want to say 17 or 18. 18.
We did the J first or the O first?
O first. Because we
Okay.
didn't have the Juliet at the time.
Okay.
When we did the O shot.
So we did the O, and we'll just describe a little bit with, I mean, the viewers, some of them are babies, some of them are little babies, so we'll just sort of preemptively say, maybe not watch this part of the segment if you want to just sort of take the child away if they're watching NTA, because, you know, we're going to talk about some stuff here, but the deal is that you take the plasma and then you inject it into the clitoris, and that helps
and
build...
the vaginal canal.
Right, I forgot that. And it helps to plump it up and it has more sensitivity. And so that's important for having a better orgasm. And inside of the vagina, sometimes when you go through menopause, it gets the atrophy.
Not just menopause, childbirth too.
Well, for me, it was really menopause. And things just started to not
Dry
do like it was supposed to do. And that is a laser that goes in and really redefines, reconnects, just re-stimulates. What does it do exactly?
So the vaginal canal, you have your lamina intima and your lamina propria. They're the two top layers, and that's the pink that you see. And then underneath that is where the muscle lives, right? And we all know childbirth loosens up the muscles, and you have obviously urinary leaking because your pelvic floor is a little bit weaker. So what the laser does is it goes in and it stimulates. It's an erbium YAG laser. So, and the reason I really want to emphasize the fact that it's an erbium YAG laser is because this technology loves water. So the reason we picked this specific device when we were looking at vaginal rejuvenation devices, we specifically picked the Juliet because of its erbium YAG technology, because what that does is I am not frying the inside of your vagina.
Right.
Because nobody wants to fry the inside of your vagina. So the erbium YAG, it draws water to it. It actually ablates the inside without burning it, quote unquote burning it, so you don't feel pain, there's no blisters, things like that. And it's actually thickening up the lamina propria and the lamina intima so that the top 2 layers of the vaginal canal are twice as thick than when you first started. So we're essentially thickening those 2 layers back to what it was
Pre-childbirth.
Well, pre-virginity too, to some extent.
Well, that's good.
Because believe it or not, I have patients that have never had childbirth and they want to come in because who doesn't like things a little bit tighter?
Yeah. Well, and I had the bladder suspension, the tummy tuck, the boobs cut down from 42 H's to 38 double D's. I've had lipo. I've had all of it. There's really not a whole lot left to do. But the maintenance is really in lasers and in the O. And you guys have always recommended annually.
So the reason we recommend annually is because you said it started with menopause. So the lack of estrogen and the continued diminishing levels of estrogen are what's thinning the lining of the vagina out. And so the vaginal canal gets dry, irritated. So initially when you start, we say do one treatment for every child you've had. Add one if you've had a lot of tearing or an episiotomy.
Right.
Just that's, if there's a lot of scar tissue that's built up, we need to add that extra. But once you go through the series and we essentially build you back where you need to be, then it's a one-time, once a year, as you know, you do it around your anniversary.
Yeah.
One time, once a year, just to keep everything tight to make up for the estrogen loss that's continuing to happen.
And it will continue to happen. There's no way around it. I mean, I've just been all over the moon trying to figure out how to balance that whole estrogen, testosterone, progesterone. It's just a mess because, Daddy was the first to do reproductive endocrinology in the state of North Carolina, and he's been dead for 18 years. Yeah. He, in his practice, was the one who was the go-to of all the other physicians for that specific thing. And when I ended up in the situation where I had those issues, I'm calling his partners who are still alive, and they were like, Alisa, we have no idea what your daddy would have done with this. We weren't a part of that part of the patient journey. And so I went all over Sugarland and was trying to figure it out. And I've had everything. I've had the BioT, I've had the Premarin cream, I've had the, estradiol tablets. I mean, I have really done the whole gamut. But I think the combination of really adding that O-shot and that Juliet makes a huge difference. I mean, it really does. And it's not scary. When people start talking about it, they're like, what? And I'm like, it's really not a big deal.
And you know what? I tell all of my patients that ask me about it, it is the least painful procedure that I do in our office. And that includes Botox, guys.
Yeah, it really is.
It doesn't hurt. And it's really not. And the downtime is not bad at all. Don't have sex 3 days before, don't have sex 3 days after.
Yeah, big whoop.
That's it.
Now, the one that you've done on me is the ding, 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 and it burns all the sun damage and fixes the capillaries.
IPL.
Yeah. And so I noticed after this heart surgery, the SIP surgery we did, that my skin looked like my grandfather. It had little broken capillaries all over it, and I think a lot of it had to do with the
meds that you were on.
Prolenta, with the heart, the blood thinners. And so that's what we did this last run, and I mean, it was just almost over 3 days. You could tell huge difference. There's still a few
spots,
but not like it was, right? And so it's just an interesting. That's really a great one.
Yeah, and you know what you did is all of these things. Some of it targets pigmentation, some of it targets texture. At the end of the day, every device we have stimulates collagen, and that's where the anti-aging comes in, right? You're stimulating collagen. That's what keeps everything up.
What do you think about this collagen drink?
So it's not a bad thing. It's also not going to maybe give you the difference. Because remember, collagen lives everywhere in your body. Yeah. Not just your skin. So you're not going to be able to direct it specifically to your skin. Which is why there's not research studies that prove that it
really does anything.
Does it hurt anything?
No.
No.
Just expensive, maybe.
Yeah, maybe. But yeah, if you're expecting it to correct things in your skin and make your things tighter and bright, that's not going to
work.
No.
Well, I think that based on, we've been friends for years. You've got to start early. Stop the aging early. Keep what you've got as long as you can.
Yep.
And then try to redirect things as it starts to go in a way that nobody can really tell, right, that it's been done.
It's so much easier to preserve, protect, and prevent than it is to
go in and try to redo it.
Yes.
Because they're redoing. I can't. There's so many women in Sugarland.
Yes.
That, I mean, you take one peek and you know they've had facelifts, they've had too much filler in their lips.
Yep.
They don't look right.
Yep.
They look plastic.
Yep.
And I have been in and out of the office for years.
You will not see anybody
not
walking out of
one
that.
person has ever come out of that office looking like that.
No.
Not one.
No.
Not
because
one.
when I touch you, I am putting my name on your face.
It's like when I shoot you.
Yes.
You know what I mean?
Yes,
I mean,
you're
there's
putting
a
your
certain
signature
brand.
on
Yeah,
it.
yeah. Yeah, and it's crazy. It's crazy that the other thing, back to the beginning of the talking about the whole process, is that the state of Texas has got to regulate this more, especially if you can make somebody blind. I mean, it's just
I told you, California is the only one that really does a good job of it.
God, it's just crazy. Ugh. Well, what's your favorite thing to do? Of all the stuff, which laser is your favorite laser and why?
Okay, so I will tell you my favorite laser is the Laser Genesis. Okay. And here's why I love the Laser Genesis. 0 downtime. Doesn't hurt. You literally can do it on anybody and everybody. You can do it tomorrow, you can do it in 2 weeks. It's never going to hurt. It is only going to give you good things.
Okay.
So it is amazing for the preservation that we were talking about. And guys, if you've never had a Laser Genesis, I think this is one of those things you have it done, and you'll look back and be like, oh yeah, my skin looks amazing. And then when you don't do it for 2 months, that's when you'll be like, oh.
Yeah.
I see that now.
Yeah.
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 And so I think it's just so versatile, and you can't go wrong with it. So.
Yeah, that's awesome. That's awesome.
Yeah.
And the other products that you've got several different lines. We've got the Obagi, we mentioned that.
We carry Obagi, we carry Neocutis, which I love Neocutis, and we are actually about to bring on Skin Better.
Oh, cool.
Yes. The research studies that they have behind their products is just, it's amazing.
Well, my favorite product, aside from the drops, the new drops, is the Hyalus.
Yes.
I could just bathe in it. I love it. I'm not supposed to use it on my arms, but I do. I use it on my face, and then I rub whatever I can get off my hands onto my arms. I just love that product. It's really
and that good skincare is very underrated. You know, a lot of our patients ask me and Dr. Desai both, they're like, what do you guys do to your skin? Why does your skin look amazing? And to tell you the truth, we really don't have time to do
lasers on each other.
We don't. We can never find the time to treat each other. And so majority of what we do is good skincare. Yeah. Believe it or not, good skincare goes such a long way. And I'll give you this analogy, right? Your skin's job is to keep everything out. That's its primary function. All the environmental toxins, all the viruses, the bacteria, everything. Mm-hmm. Now I'm trying to put things in. I'm telling you, Alisa, go ahead and put some hyaluronic acid in. Go ahead and put some vitamin C on your skin. And go ahead and put some growth factors onto your skin. But why are you going to spend, hundreds of dollars on these things if your skin's job is to keep it out, right? So the reason we carry the skincare that we do is because that's the difference. Is all of the medical grade skincare has to have research studies that prove that it does what it says it does. You're paying for the carrier system to carry it deep into
So it does its job.
So it does its job. Mm-hmm. And believe it or not, that goes a long, long way. So if downtime is an issue, if budget is an issue, if lifestyle is an issue, if you don't do anything else, invest in good skincare.
Yeah, for sure. And for your children too, early on. Because acne wreaks havoc on all those little faces. And we've got, when Brian and I were in school, they would give them tetracycline.
Mm-hmm. We still do.
And a lot of scarring that's with them for life.
Yeah. And remember, antibiotics have their downside too, right? Mm-hmm. You're going to kill your gut bacteria. Mm-hmm. So, yeah, the earlier, the younger kids. Treat it because you're saving them so much grief later on.
And the most important of all is sunscreen.
Yes.
Especially in Texas.
Yes.
Yeah, big time. And they have a tinted sunscreen because y'all know I'm taping. So when I go out there in the garden and I'm doing my show, I've got my tinted sunscreen on so that I still look like I'm supposed to look. Sweating.
And we don't have to call her and say, excuse me, all of my hard work, what are you doing?
Yeah, exactly. I don't get yelled at whenever I use my sunscreen, which is a good thing. So, well, all the information on how to get a hold of them is going to be in the episode notes below. There's going to be specials. You've got specials. You just gave away a great big basket full of goodies. I'm sure that one of those will probably be happening again in the fall.
Yep.
You mentioned something about acne. You're going to be doing a special.
So we turn 10 next month. It's our 10th birthday, guys. That's how long we've been around. And so we wanted to do a big party, but something we wanted to do is take it back to our younger clients, because we love you guys.
Right.
But I feel like for that reason, we wanted to kind of gear it towards them, and we want to do a big education and a seminar, and then followed by a celebration specifically geared towards acne and how to prevent it, how to treat it, and if you already have it, let's figure out how to correct it.
Yeah, get rid of it. Yeah. So when's that coming up?
August.
Oh, cool. Okay, perfect. Wonderful.
Next month.
That's awesome. Well,
and then
listen.
August 26th, come to our birthday party.
It's August 26th. I'll still be here.
Yeah.
I'll be here. I'll be there. Listen, guys, I hope you found some value in our Martini Talks. I know that I always love spending time with you and with Nina as well. And we have so much fun. You guys have got to go down to the spa and check it out and just look at all the different things and do a consultation. Figure out what's right for you. And know that when you're getting it done, we're not doing it just willy-nilly.
No.
There's just a lot of training, a lot of thought, a lot of really good customer service and good patient care, I should say.
Thank you.
And I really appreciate you guys. I appreciate you being here today, and I really appreciate you guys for taking care of me.
Thank you
all
for
these
having
years.
me. And I'm happy to answer any questions on anybody. And all of our website has pictures, before and afters, videos.
I'm probably even on there. I don't even know. I probably am.
You probably are.
I think I am. Y'all always taking my pictures before and after, so I'm probably on there as well. Anyway, we hope that you found value. If you did, please do us a favor, like and share. Don't forget to ring the bell, and we'll see you soon on another Martini Talks. Take care.
Bye.